Okay, we've been called out to a patient that's fallen from a tree approximately 2 metres. We've been told that he has a broken ankle and a laceration to his left forearm. Upon looking at the scene, it is clear and safe. We can see a branch that it has fallen down and also the saw, so we'll have them cleared. Other than that, the environment is good and we feel safe. We're wearing our PPE, our glasses, gloves and boots, as you'll see on my partner here. Do you feel safe to enter?
Yep, safe to enter.
Okay.
Yep.
When we get in, could you please start taking a full set of vitals?
Okay.
Cool. Hey mate, it's Devin. I'm from St. John's. What's your name?
John.
John. What's been going on, buddy?
Just getting some work done on the tree there, and then something must have broke and fell through. And
What do
going on right here.
Who's been having you up the tree? The wife, is it?
Yeah.
I was up the tree the other weekend.
You didn't fall as
I
well?
didn't fall though, mate. No, I was a little bit smarter than that. So what did you do? Did you trip?
Yeah.
Trip on a branch?
Yeah, I think I just made the wrong step and just broke and fell down.
Bugger.
Yeah.
Hey, now you're bleeding quite bad here.
Am I?
We're going to need to take some vitals and
Sure.
start wrapping you up. Is that okay?
Yeah, that's okay.
All right, mate.
Thanks.
So how long have you been laying here for?
I'm not too sure. Probably a good 10, 15 minutes.
10 or 15 minutes, yeah? And do you know what date it is?
Yeah, it's the 1st of June.
1st of June. Sweet as. And can you remember when you fell? Was there anything weird that happened? Before it was all okay?
No, not
Pretty
really.
standard, it's just an accident.
Yeah, it's just my footing. I think I just made the wrong step and just broke the branch or something.
Right, okay. Well, you won't be doing any ballroom dancing anytime soon, will you?
That's not too bad then.
That's not too bad, yeah. No, I try and steer away from that too. Hey, now, John,
Yep.
we've got this wrapped up. We're going to keep it elevated here. Just pop it up here.
Okay.
I'm going to have to do a bit of a trauma sweep down your body. I want to make sure that I've got all the different injuries, okay?
Yep.
And make sure that we haven't missed anything.
Yep.
It's a little bit invasive. I have to touch you around the face, down the back, neck, underneath. Okay, are you all right with that?
I'm okay.
All right.
Yeah.
You just let me know if it hurts anywhere,
Yeah.
and if you feel uncomfortable, I can stop.
Okay.
All right, mate?
Yep.
Okay. Just take a picture, mate.
Sure.
Okay, so just coming through here. It's okay?
Yep.
Yep. The blood on the back of his head, coming down his neck.
Just a small prick, mate.
Just there?
Yeah, it's a bit
Yeah?
tender there. But
Okay, what about out here?
that was a little not as much
No?
as the neck.
Just keep your head still, buddy.
Yep.
So just here?
Yep.
All right.
Sharp sweep.
Okay. What we need you to do is make sure you keep your head very still, okay?
Okay.
Just because we're concerned that you may have hurt your neck and we don't want it to be damaged any further.
Okay.
Once you finish with that arm, can you just check that as well, that that's fine all the way down there?
Yep.
So, coming through here, that's all good. We know you're pretty sore through here.
Yep.
Give us this hand. Squeeze my hand. Big squeeze. That's good. Good cap refill. Okay. Okay, now I'm going to come down the centre of your chest and tell me if it's sore. That's okay. I'll
Yeah.
try not to tickle you. Okay, big deep breath in and out and in and out. Okay. Checking for any blood. I can get my hands underneath the arch of his back to ensure that there's no other injuries there. I will not be rolling this patient as there's a possible C-spine fracture. We don't want to do anything to that. Through palpating the stomach, we're going to find or look for any hard, abnormal parts of the stomach that could indicate internal bleeding. That's good. How are the hips here, mate?
Yeah, it's not too bad. It's fine.
That's all right.
Don't feel anything.
Okay, and this leg?
Yeah, it's fine.
That's okay. That's okay. How's that? Can you feel that?
Yep.
Wriggle your toes. Good. Coming down this leg. Well, that's tender.
Yeah, it's a bit sore. Don't do
Let's expose that.
Yep. Okay.
Okay, we'll expose that. Now, as we can see that it is swollen, bruised, we can use the plus discs acronym to help us evaluate whether or not it's fractured. We're going to expose the opposite limb, like so. And yeah, they're definitely deformed on the right ankle. So, can you feel this?
Yeah, a little bit.
Yeah. Wriggle your toes for me. It's a bit sore when you do that?
Yeah.
Yeah?
Pretty painful.
Okay, so we're looking at both of them. There's a slight cap refill delay to the injured ankle, the other one's fine. They both feel cool, but I'm happy with that, that's okay. Okay, so it looks like you've got a broken ankle, okay, and I'm worried about your neck. Could you get out the C collar, please? And a couple of those towel head blocks. What was the vitals you got?
Yeah, so vitals, his pulse is normal and regular, blood pressure 120/80, heart rate sitting at 90, respirate 18, he had a temperature of 37, but glucose level is 6.8, and his peripheral cat refill time was 2 seconds.
Very good, thank you. Alright, so if we get that ready, come in the back here. Alright mate, if I get you to hold his head for me please.
Sure.
Okay. Alright, so what we're going to do is we're going to put this collar on.
Yeah.
Okay, it's going to be really uncomfortable,
Okay.
and it's possibly going to hurt, and it
Okay.
could make you feel worse, right?
Yeah.
But by doing this, we're going to support your head and hopefully mitigate any further damage to your neck.
Okay.
Alright? Contraindications of this is it can delay the venous return and intracranial, cause intracranial pressure. Okay. Alright, so we're going to come through here. On my call, mate, we'll just slide this through. In 3, 2, 1. And coming in and under. Is that okay?
Yeah. Not too bad.
It's not too sore?
No.
Yeah?
Yeah.
Okay.
Cool.
So my partner keeps a hold of his head. I can roll up some towels to block his head here. And then on the opposite side. This allows any lateral movement of the head to be mitigated and also to free up my partner's hands. Okay, I've just noticed that this hair's bleeding through.
Okay.
Could you organise another bandage on that, thanks?
Sure.
That stethoscope handy?
Yes.
Thank you. Alright, so from here, because we know you've got a fracture and I've got another one here, what's your sort of pain level at the moment? 10 being the worst you've ever felt?
Probably around between 7 and 8.
7 and 8, okay, so you're in a bit of pain. So a pain med that I'm going to start thinking about for you is called methoxyflurane.
Okay.
Have you ever heard of that?
No, I haven't.
No? Have you ever seen this? It's called the green whistle.
No. Nope.
No? Have you or your family had a history of malignant hypothermia?
No.
Never heard of that?
Never heard of it actually.
What about any renal impairments, problems with your kidneys?
No.
No?
Usually pretty good.
So in saying that, you're talking to me in clear sentences, you're coherent,
Yeah.
you haven't seen this before, therefore you haven't had this drug in the last 7 days.
Yeah.
This drug is, you're allowed up to 6 mils in 7 days for an adult. They're 3 mil doses. Just looking at the drug and date, could you please just check that for me?
Sure.
Say it out loud for us.
Methoxyflurane expires December 16, 2018.
Very good, that's correct. Okay, so before I give you this, I just need to osculate your chest, okay?
Okay.
I just need to sit here for clear air entry and exit.
Yep.
And this is going to make me feel happier giving that drug to you and just make sure that there's no other injuries there.
Okay.
Whilst I'm doing this,
Yep.
will you be able to sort out a box splint in the
Sure.
ties? Thanks. Okay, so I'm going to have to come in underneath your top and under that way as well. Is that okay?
Yeah, that's okay.
All right. All right, big deep breath in and out the mouth. Good. Good. Just bring this arm up here. Just going under your shirt. And again. Good. You sound hungry.
I am.
And again. One more time. Okay, very good. That sounds nice and clear on both sides, which is good. Okay, so now what I'm going to do is take your blood pressure again and just compare it to the last one that we had.
Yeah.
Okay, so to do this, we can find the brachial pulse here. And then we can pump our blood pressure cuff up until we don't feel it anymore, which is just there. So then we release. That would be the systolic. Pump that back up. Nice big pressure. Okay, that's dropped a little bit. What's your blood pressure normally, John?
I'm not too sure. Last
Not
time
too
I
sure?
checked, it was usually pretty healthy.
Pretty healthy and good,
I
yeah?
was at GP last year.
Right, okay. That was 90 over 50, so it's dropped considerably.
Oh, wow. Okay.
Okay. Still check. Just going to check the last set of bottles here. So, have you got any allergies that we should know about?
No, I'm not allergic to anything. No.
No? You don't take any medication?
No, I don't.
So you're otherwise fit and healthy?
Yeah. Well, except for today.
Except for today. Yeah, you got 2 left feet today. You do, actually, looking at that. Okay, so he's gone a little bit tachycardic, and he's actually looking a bit cold and clammy, isn't he?
Yeah.
Okay. Right, whilst I'm getting this ready, could you arrange nasal prongs set up at a flow rate of 3, please, just to help that, and we'll just get them started on this methoxy first. Okay, so this is a self-administered drug, so you're going to have to do that yourself.
Yep.
We've already spoken about the contraindications, so we're good to give this to you. When you use it, you breathe in through here and out through here. You don't blow out into the air, okay? You go in and out all the way through here.
Okay.
All right?
Yep.
If you need a bigger dose, you put your thumb or finger on there, and it'll give you more of a dose.
Okay.
It's quick acting,
Yep.
but it's only a short time in your body, so you'll release it quickly as well.
Okay.
So you just have as much as you need. Okay? Throw that over your wrist. Got that there. Now show me how you do it. So in and out. In and out. One more. And out. I think they're just hearing. Oh, you got that all sorted? Yep. Okay, how are you feeling now? Pain level?
Yeah, it's actually due for some sort of improvement.
Yeah, definite. So what number would you be at, you'd say?
Yeah, well, probably 6.
6. Have another couple of puffs on that, and then we're just going to set up some oxygen for you. Okay.
Okay. Yep.
They're a little bit uncomfortable, but they're going to help with your breathing and all your oxygen levels.
Yep.
Okay. And then I'll get you down here with me and we'll box sprint this leg. Thanks. All right. Get down here. Is there another one of these? All right, so if you go above and below the fracture, we know that it's a fractured ankle here by the looks of things. So if we can support above and below the fracture and lift that evenly, I'll slide that in and under, get the bandages under, and then we can slowly lower that limb.
All right.
Are you good with that?
Yep.
Have a few big deep breaths on that, please, John. And again, one more. All right, mate, you want to get ready for this?
Yep.
Okay. And 3, 2, 1. Well done, mate. Well done. Okay, just do one last lift on that. 3, 2, 1. Yep, good. Well done, John. I'll get you to tie this up on there. How's the pain feeling?
Yeah, much better. Probably like a 5 now.
Yeah, good.
Yeah.
Like I said, you just have as much as you need.
Okay.
Okay. When we're doing wrapping the wound, the fractured ankle, we would ensure that we wrap above and below the site of injury, so we can keep a good eye on the perfusion rate and any other swelling that may occur. From here, I can take my distal pulses again to make sure that we still have a good pedal pulse, which are good. They're both bounding. Look at the cap refill. Still slightly sluggish compared to this one. And they're still a little bit cold, but we'll get onto that. All right. Okay, so this leg's done. That's done. How are you feeling?
Yeah, it's better.
Have a look at your arm.
Sure.
Okay. Right, we're going to have to put a tourniquet on your arm. Okay.
Okay.
This wraps around your bicep.
Yep.
Okay, and it's going to be sore and uncomfortable.
Okay.
But we have to stop this bleeding. It's not stopping like it is
Still
now.
bleeding,
Okay,
okay.
it's still going.
Yep.
Once we put this on, it has to stay on until we get to the hospital, okay?
Okay.
All right, but this is the only way that we can do it.
Okay.
All right, mate? It's going to be sore, so you're going to want to suck on that. I'm just going to lift this up. So from here, we would tighten this, put the Velcro on. We would open this here. We would then spin the spindle until it is tight and we can no longer feel the brachial pulse. For the actor's comfort, I'm not going to do that. We would then lock it back in, bring this across, and write the time in which we closed it off. Check again, there is still no pulse. We would get some shears. We would then cut the bandages off to expose the wound and see that there is no longer any blood flow coming out. Once that happens, we know that our patient is ready for extrication. When we have the patient in the back of the ambulance, we would look at stacking his pain relief with the likes of paracetamol and ibuprofen. We would not be doing that here as he is supine and it would be difficult to swallow these drugs. Thank you.